Welcome back to the Best PT Podcast. This is episode 4.13, PT Interventions for the Cardiopulmonary System. This is the last episode of the Cardiopulmonary System. Let's start with exercise stress testing. You may have heard some named tests such as the Bruce Protocol, the YMCA bike test, etc. You should know when giving a stress test absolute and relative contraindications. Absolute contraindications include a drop in systolic blood pressure over than 10 millimeters of mercury, despite an increase in activity load, as well as the presentation of other ischemic signs, which include angina scale report of 3 or more, which remember is a moderately severe report, ataxia, dizziness, cyanosis, pallor, ventricular tachycardia, or a 1 millimeter ST elevation on an EKG. Relative contraindications: a drop in systolic blood pressure greater than 10 millimeters of mercury despite an increase in activity load but without ischemic signs. You may also see a greater than 2 millimeter ST depression, fatigue, shortness of breath, wheezing, leg cramps, an increase in chest pain, and also a relative contraindication is systolic blood pressure greater than 250 or diastolic blood pressure greater than 115 or both. Homan sign is a test that involves passively dorsiflexing the foot with the knee extended. Production of pain in the calf or especially the popliteal space may indicate a DVT warranting further evaluation. Mediate percussion is the tapping on the body to identify areas of altered density. So use a dummy hand procedure with laying your fingers over one of these areas and then strike your own fingers with your other hand. Interpreting these sounds: flat or dull sounds are normal over the thighs, but can indicate cancer, atelectasis, or consolidation when heard over the lung. Resonance is a percussion sound that is normal over air-filled lungs. Hyperresonance is heard over a lung with emphysema or pneumothorax. This sound is a mix of resonance with tympany. Tympany is a hollow sound like a drum beat, very likely to be a large pneumothorax when heard over the lung. Grading pulses with peripheral artery pulse palpation. A grade of 0 is no pulse. A grade of 1 is a smaller reduced pulse. A grade of 2+ is normal, and a grade of 3+ is a large or bounding pulse. Pulmonary function testing, or PFTs, are the measurement of forced vital capacity, FVC, peak expiratory flow, PEF, and forced expiratory volume in 1 second, or FEV1. Interpretations for obstructive impairments: you'll see a decrease in expiration values in the FEV1 divided by FVC less than 70%. So 70 to 100% is normal to mild obstruction, 60 to 70% is moderate obstruction, 50 to 60% is moderate to severe obstruction, and less than 50% is severe. Obstructive impairments indicate airway narrowing during exhalation. Restrictive lung impairments present with decreased lung volumes. The forced vital capacity is reduced, but FEV1 divided by FVC remains greater than 80%. The rate pressure product, RPP, double product, or cross product, is an index of myocardial oxygen use and coronary blood flow. It's useful to guide exercise prescription. It's calculated by multiplying the heart rate by the systolic blood pressure and reported as a number times 10 to the power of 3. Respiration rates. So newborns breathe the fastest, 33 to 45 breaths per minute. At 1 year old, 25 to 35 breaths per minute. 10-year-olds breathe 15 to 20 breaths per minute, and adults have 12 to 20 breaths per minute. So if you've ever been around little kids, toddlers, and school-age kids, they always seem like they're hyperventilating, but that's normal for them. A normal inspiration to expiration ratio is 1 to 2, so you should breathe out twice as long as you breathe in. COPD patients, because they have airway narrowing, have a ratio of 1 to 3 or 1 to 4, meaning they have to expire more or take longer expiring. Aerobic exercise prescriptions for cardiopulmonary patients follow ACM guidelines. Remember the FIT principle: frequency, intensity, type or mode, and time or duration, FITT. Frequency of exercise should be 3 to 5 days per week. Intensity should use heart rate max with adjusted age heart rate max or the Carbonin heart rate reserve method. Remember that method is a calculation where you have age-adjusted heart rate max minus resting heart rate times your intensity level. So an intensity level of 40% would be 0.4, and then add back in the resting heart rate. And then do it again for the upper limit of intensity to find a heart rate range. Type or mode of exercise is really whatever someone wants to do: aerobic, anaerobic, weightlifting, whatever they will do and stick to 3 to 5 days per week is the best exercise. Time or duration. It's recommended 20 to 60 minutes of low intensity and 20 minutes or more of high intensity. Moving on to airway clearance therapies: active cycle of breathing, forced expiration or huff coughing. Procedure: gentle relaxed breathing for 5 to 10 seconds, 3 to 4 deep slow inhalations, followed by a forced expiration of 1 to 2 huffs, and compression of the thorax with glenohumeral adduction. So kind of squeeze your arms like chicken wings, compressing your own thorax. Autogenic drainage is used to control breathing in order to mobilize secretions. The patient should slowly breathe through the nose, hold 2 to 3 seconds, and then exhale. They should continue to breathe normally with 2 to 3 second holds, and then begin deeper inspirations with breath holding and followed by a huff. Directed cough or huffing: the patient should inhale maximally, hold their breath for 2 to 3 seconds, and then cough sharply 2 to 3 times. Then inhale deeply with an open mouth, then contract the abdominal muscles while exhaling out, saying ha 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 to get that huff going. High-frequency airway oscillation tools. Brand names include the Acapella or Flutter. These use positive pressure and oscillations to mobilize secretions in the lungs. And then finally, postural drainage techniques include the use of gravity and physical contact through percussions and shaking to drain bronchial secretions. So look at pages 281 to 284 of the Square Builder study books for some really good photos of the different postural drainage positions. Breathing exercises. Diaphragmatic breathing is best initiated in hook lying. Have the patient sniff to contract their diaphragm, and then use their hands for biofeedback. The distal hand should be over the stomach, the proximal hand over the chest. The stomach should move into the distal hand with inspiration and move away from the distal hand with expiration. The hand on the chest should always remain still. Inspiratory muscle training: 2 different types, the threshold and the P-flex. The threshold is an analog device that kind of looks like a pipe, and it has spring-tuned resistance with a crank. The P-flex, very similar, although it has a dial that occludes the amount of air that can enter the device. Paced breathing is exhaling with effort in order to prevent breath holding during activity. Pursed lip breathing is a slow leak type of breathing. Ask the patient to breathe in slowly through their nose and then out slowly through tight lips without holding a breath. Segmental breathing involves the patient inhaling against PT resistance over a lung segment. And then sustained maximal inhalations or incentive spirometry. Those are those little devices you always see in the hospital where you have to keep the ball in the air. Dyspnea relief positioning. The reverse Trendelenburg position is supine with the head supported above the trunk and extremities. And then semi-Fowler's position, which is hook lying with the head of bed elevated 45 degrees. Talking about cardiac rehabilitation, it's important to know that inpatient is much shorter than it used to be. Inpatient or phase 1 cardiac rehab lasts 3 to 5 days in the hospital. And now outpatient, phase 2, immediately follows inpatient and lasts approximately 12 weeks after discharge from the hospital. Cardiac rehab used to have up to 5 phases, but now is mainly 2. Met values or metabolic equivalent values. These are calculated through equations given by the ACSM, but some numbers you should know. for people to be able to perform different levels of activity. So to be able to perform a slow walk, you need to be able to tolerate a MET value of 2, jogging a MET value of 8, normal household ADLs 2 to 3, yard work 5 or more, court sports like basketball or tennis 8 or more, and then one you'll probably be asked the most about by your patients is when can they return to sexual activity. That occurs when they can tolerate 4 to 5 METs. Pulmonary rehabilitation is similar to cardiac rehab, but it's usually almost always outpatient. There is very rarely an inpatient phase. The emphasis here is on improving 6-minute walk test performance and other exercise-based tests. It's also when airway clearance and breathing technique exercises are performed and taught for patients to do at home. And then finally, CPR. Remember, compressions should be at least 100 per minute. Maintain the airway with a head tilt chin lift. Apply 30 to 2 compressions to breaths for a single rescuer, and 15 to 12 for children and infants with 2 rescuers. You can apply 1 breath every 6 to 8 seconds if you have 2 rescuers and an ambu bag. And then remember to attach and use an AED as soon as possible. That's it for episode 4.13, PT Interventions for the Cardiopulmonary System. If you've been with me since the beginning, we have now covered 72% of the MPTE material. Episode 5 will cover the integumentary system. As always, the outline for this episode is in the show notes. Thanks for joining me.